have every belief that before this century is over, people will talk about drug prohibition the way we talk about alcohol prohibition, a stupid, failed experience that should have never been started. I know that.
We have reams of evidence showing what sorts of programs and interventions and services are effective in protecting the health of individuals and also the health of communities more broadly. But often those things are either verboten by governments or vastly underfunded in relation to all sorts of things that are not well supported by the evidence, such as many of the more punitive law enforcement sorts of approaches. And in fact, some of those approaches, the evidence shows, are actually counterproductive and damaging to both human rights and the health of individuals and the public.
What do? You stand up and say, yeah, we're really behind prohibition because it creates crime and gives an enormous trade to the mafia and drives HIV and ruins inner cities and doubles the prison population and creates 95% of street prostitution. Not a good one to stand up and wave a flag about.
So about 20–25% of the people behind bars in our country really have mental health problems. They should be getting mental health care, but what we offer them is a prison cell. Another 25% of the people in prison are there because they have drug problems. Instead of giving them drug treatment, we offer them a prison cell.
One that I really like to propose when I talk to people who aren't involved in the drugs field is to say, well, if we have people who are diabetic and they're going to eat chocolate, and they know it's not going to be good for them, but they're going to eat it anyway. Are we going to send them to prison because they've eaten chocolate?
Almost everywhere, the poor are disproportionately affected by punitive drug policies. Minority communities, whether they're ethnic minorities or racial minorities or religious minorities, are also overrepresented in the people who are negatively impacted by punitive drug policies. So that's consistent no matter where you go.
The major challenge for Thailand will be, and not just for Thailand, but for Asia as a whole, is to make sure that their drug control policies and the objectives of their drug control policies are in line with their public health policies and their public health objectives.
We've had needle exchange programs for 20+ years in Canada that enjoy widespread public support. So I think people get the basic concept that this is something that needs to be dealt with as a health issue. And I think our federal government that seems to be so insistent on yet more of a law and order approach and abandoning harm reduction, I think they're actually losing favor with the Canadian public on that point.
I think that it's absolutely unconscionable that all these years into the HIV/AIDS epidemic that we still don't have a national policy of providing funding for needle exchange, which we know works and doesn't increase substance abuse.
With alcohol prohibition, it was just one country. What we've done is recapitulated that on the global stage. I mean, it's madness, madness.
There have been 14 states in the United States that have passed laws to allow for medical access to marijuana. And these are through initiatives that were approved by the voters or through legislation that was approved by state legislatures. Our federal government still refuses to allow those states to implement the law that their people have voted for.
All drug policy is based on myth, faith, and dogma. And so are all the kind of reasons why people believe that they can't get out of it. It's the same thing. So the evidence doesn't engage there.
Our federal law requires that a person who's convicted of selling 5 grams of crack cocaine must get 5 years in prison. Now, you know, regardless of what you think about the morality or whatever of this issue, from a practical point of view, 5 grams of crack isn't even worth $1,000 on the street in any city in the United States. It costs $30,000 a year to keep a person in federal prison, which means that as a policy, we're willing to spend $150,000 to lock somebody up for a $1,000 crime, but we're not willing to give them $10,000 to go to college or $20,000 for federal housing or anything else that would actually allow them to have a more productive life. I think that that is like insanity.
So we talk about regulation now. So the end game is the legal regulation and control of currently prohibited substances. The end of prohibition, its replacement with an effective, just and humane system.
They say that, you know, insanity is doing the same thing over and over again, expecting a different result. We've been pursuing this drug war now for almost half a century, and it hasn't produced a different result. So I'm clear the problem is us and not the drugs.